In 2018, public and private institutions came together in Sarasota to solve a problem. The group called themselves First 1000 Days Sarasota. They've been so successful that the initiative expanded and is now known as First 1000 Days Suncoast. They wanted to improve the care offered to families and offer wraparound, holistic care that started before a baby is born and followed the family as the baby grew. This kind of care has been shown to decrease the health disparities Dr. Remke mentioned in her presentation. Here's how they did it.
First 1000 Days Suncoast brings together over 75 organizations and parents who are working to build a supportive network for families in our community. By sharing data, offering targeted interventions, coordinating care, and empowering parents, we strive to break cycles of abuse, eliminate disparities, promote healthy parent and child relationships, and improve family resilience. Together, we will make the Suncoast region a healthier, more equitable, and productive community.
How did you get started?
We were working with the Charles and Marjorie Brancic Foundation on something called Talking is Teaching. And because All Faith, the food bank, reaches 80 to 90,000 people every year, they thought, well, at least the food bank can hand out these pamphlets and talk with these families at the food distributions about how important it is to sing and talk with your child and read to your child. This is really grassroots. This whole thing came from the ground up. And it reached a point where Brancic Foundation, Terry Hansen, said we probably need to convene in a little more formal way and continue to think about who else should be here, who else should be a part of it. So they started convening this group.
As we built that trust in each other, we found that the solutions began to appear. The hospital was ready to be the backbone organization for the initiative. And, through that, we ended up hiring the staff. We decided to hire staff to lead this First 1000 Days initiative in our county. And with the resources of the hospital, we were able to bring the staff member in here. Everybody who's got interactions with families, pregnant women, young children need to be at the table. I think every organization recognized how hard they were working and recognized that there were difficulties and barriers that everybody was facing, but you couldn't have time to solve all those problems. You could help with one interaction, maybe with one of your community partners, and get that sorted out and do these little bits of work around. But I think in funding one FTE and hiring the right person into that role, that has taken our entire system to a whole new level. Having one person whose sole job it was not to be connected necessarily with any one organization, but to represent everybody through this initiative and to bring the organizations together, having them trust each other, really has just moved us to a new level. During the development of the collaborative, we realized the need to have put together a steering committee. So we really formalized that process. We've got a 12-member steering committee right now made up of parents and representatives from a diverse group of our community-based organizations. And of course, our program coordinator, Chelsea Arnold, is on that steering committee.
What are some things First 1000 Days Suncoast does?
The Unite Us platform has given us an electronic referral database that's HIPAA compliant. What that has done for us is allowed there to be no wrong door in any agency on the platform in our entire community. So for example, the food bank is on the Unite Us platform. If a mother is going to the food bank and trusts them, they can pop mom into the Unite Us platform and send referrals for her to wherever that mother needs next. If the mom has a connection at Mothers Helping Mothers and she feels trust with them and agrees to get help from them, the Mothers Helping Mothers staff have access to the Unite Us platform and can see all of the agencies that can help this mother.
We have community murals that went up that were commissioned by different local artists. And then we are putting on some programming at the Sarasota County libraries. We're putting up banners with the local art and going to be doing some different art activities. We're really just trying to drive traffic to the initiative, and Sarasota is an area for culture and arts, and so we felt like using art as a medium was a really exciting idea. So that's another thing that's been going on as well.
I remember when they presented the ideas, and there was a group of only parents that they asked us, what do you think? Which one do you like the most? And it was a great conversation between parents. And from there to see the drawing, to then look at a big wall and see it there, like live, is like, yes, we parents did it.
What makes this huge project work?
Starting from the ground up, a groundswell of people with a united interest, an awareness of the data and the need.
No initiative is going to be effective if it doesn't have not only the feedback, but the final decision of the community itself. Parents are very important to be as present as they can be, because they are going to be your final consumers.
Collaborative, seeking input from the diverse people at the table, looking at all the different perspectives, weighing those and reaching a decision that's in the best interest. I hope it's in the best interest of the child that we're talking about, the children that we're talking about. I believe we are only beginning to see the benefits and the outcome of this effort. It was necessary to put good time into building the foundation because we wanted this to be sustained. So it was really imperative that we build a deep, strong foundation for First 1,000 Days.